Hi friends. In this video, let us see about a medical software, an EHR system named MetaVision. Okay, this has been in the market for more than 9 years. This is this software is especially designed to take care of the ICU patients, like the patients who are in need of a surgery or old age patients who need some extra care. So this take care of the patient data when this app takes care of the medical data of the patient who are in the ICU, like before operation, then during the surgery and after the surgery, prior to discharge, everything, all the records will be maintained efficiently by this MetaVision. So, if a patient is admitted in the ICU, there will be medical equipments attached to him, right, to monitor his vitals. What this MetaVision does is that it gets connected to these medical equipments and their server will be getting data from these equipments periodically, and based on that data, it will create a portal for the doctors, like the vitals. In this app, they have taken mainly taken care of the heart rate and then the oxygen level. Like in COVID time, how oxygen level was mandatory for checking any COVID patients, right? Then they have taken care of the BP levels, both systolic and diastolic, and then the body temperature, basic body temperature of any patient admitted. So all these readings, it will be updated in the doctor's portal. Like someone say if ICU has 10 patients and a particular doctor A is in charge of it. So his portal, his tab will have all these details in his home screen. So in the morning time, if the doctor is planning to do revisit like the ICU rounds, he'll just check his portal. So from his portal, what can observe is that the patient Stephen Norland, his heart rate is high, like 180, 130, I guess. Yeah, and his temperature is 39.5 degrees. So the doctor decides to first consult him and revise his treatment plan based on his severity. So he visits that particular patient, and this app also allows the feature of letting the lab technician upload the lab reports of these patients directly to this portal, and also it sends reminders, like it can remind the nurse or a doctor about updating the medication or giving the medicines on time. All these details will be recorded here. So if the patient doctor is deciding to change the medicine of this particular patient, since Stephen Nolan is quite serious now, he's deciding to change his medicine, but this app intelligently warns the doctor that this patient is allergic to that particular medicine, because they must have taken a blood test, right? Since he's an ICU patient, they must have taken a blood test prior that to check if the patient is allergic to any particular medicine, that resistance and tolerance test. So this app got the data from that lab test and it's updating the prompting the doctor priorly. And as I mentioned earlier, it will also be showing notifications, like if there is a timer, if they have given any lab test, so it will prompt if the test result have arrived, and if the patient is in surgery, if the patient, the doctors will be seriously taking care of the surgery, the procedures, right? So if the patient's blood level falls, blood pressure level falls, or if the antibiotic timer has expired, it will send a trigger so that the doctor will inject the second dose of antibiotic, and all these notifications will be helpful. And as mentioned, it will also prompt the nurses about the time. So it is now time to give this medicine to this patient. Like all these notifications, it will be given. Also, it allows data sharing facility. Like if there will be a doctor who is in charge of the particular patient who are all in the ICU, right? Other than that, if the patient needs some specialist access, like a cardiologist or a dietitian or some other ortho doctor special care, if the patient is needing, so they can also, those doctors will also be given access to this data, and they can have a look at the patient and they can update the treatment plan based on the recommendations, right? And once the medical procedure is over and if the patient is ready for discharge, this app will also easily generate a billing report, like the entire bill from the right from the initial stage, then the surgery, and then the discharge date, everything. The bill will be ready, and they will also generate the discharge summary, which is most necessary. All these details will be generated, and if the insurance claim has to be made, it will also generate that particular report correspondingly. So, this MetaVision app is about taking care of the ICU patients, like maintaining a single flow sheet throughout the entire stay, right from the checking the doctor, then pre-operative stage, during the surgery, post-surgery, everything will be taken care. Okay, I'll come up with one more medical software in the next video. Hope you all understood this. Thank you.